Good morning, the committee and audience. My name is Warintorn Bunyanukul, the fifth-year medical student from Faculty of Medicine, Prince of Songkla University. Today, I'm honored to present the study entitled Economic Status and the Prevalence of Single and Cluster Non-Communicable Disease Risk Factors, finding from the 2021 Health Behavior of Population Survey in Thailand. Introduction: non-communicable disease or NCD are significant health burden that can be prevented by addressing behavior risk factors such as smoking, alcohol consumption, physical activity, unhealthy diet, and overweight or obesity. They cause 41 million deaths globally and 400,000 deaths in Thailand. NCD costs more than 1,000 trillion baht globally and 1.6 trillion baht in Thailand. So, reducing this factor is crucial. Previous studies have found that clustering patterns vary by population. However, in Thailand, there is no study on the clustering of this risk factor. The study objective: first, to determine the prevalence of single and cluster NCD risk factor in Thai population. Second, to evaluate this association between economic status with the single and cluster NCD risk factor. Methodology: we analyze data from the complex survey of the 2021 health behavior of the population survey, which is a cross-sectional survey by INSO. The survey includes 84,000 households with members aged over 15 years, representing population of 26 million participants. The primary exposure variable, economic status, include 5 risk factors. Other variables include sex, age, residence, education, arrangement, regions, and economic status. Economic level was defined as shown in this table. Statistical analysis. We use the R program to analyze data. Descriptive data are presented as frequency and percentage. The odds ratio was adjusted, which was obtained using multivariable logistic regression. A heat map was used to visualize the estimates, where green indicate low value and red indicate high value. We apply a Venn diagram to explain the co-occurrence of risk factors. This result show characteristic. This result show characteristic of the study population. This figure shows the prevalence of risk factor in all cases. The most prevalent risk factor was an unhealthy diet, 56.9%, followed by overweight, physical activity, alcohol consumption, and smoking. This table shows the prevalence of risk factor by economic level. The lower economic level has the highest prevalence of almost all risk factors, except alcohol consumption. However, the higher economic level has the highest prevalence of alcohol consumption. This figure shows the prevalent co-occurrence of NCD risk factors. The most prevalent pattern was having 2 risk factors at 35.5%. Moreover, 92.6% have at least one risk factor. Proportion of occurrence of risk factor by economic status. Individuals with 1, 2, and 3 risk factors had the highest proportion in the low economic status, while those with 4 and 5 risk factors had the highest proportion in the high economic status. We can see that as economic status increased, the number of risk factors also increased. This Venn diagram shows the frequency of single or multiple risk factors. The most common co-occurrence was overweight and unhealthy diet at 11%, followed by 3 factors, including overweight, unhealthy diet, physical inactivity at 6.7%. Adjust odds ratio, showing a dose-response relationship for this association were observed. As economic level increased, the odds ratio of alcohol consumption, unhealthy diet, and overweight is also increased. In contrast, the odds ratio of physical inactivity decreased compared to those of participants with very low economic status. We also explore the relationship between economic status and the clustering of risk factors. As economic status increase, the likelihoods of having multiple risk factors also increase, with a higher odds ratio as the number of risk factors grew. Discussion over study found that high economic status is associated with having multiple NCD risk factors and the highest prevalence of alcohol consumption, consistent with pattern observed in England, Brazil, and South India. In contrast, this trend differ in Vietnam and parts of Asia. The strength of this study is that it is the first study in Thailand on the clustering of risk factors for NCD. However, this study does not analyze specific economic driver of NCD. Further research should focus on the economic factors of NCD risk to develop target intervention. To conclude, the majority of Thai people, 92.6%, have at least one risk factor, with one-third having two risk factors. High economic level are associated with increased alcohol consumption, unhealthy diet, and overweight or obesity, but a decrease in physical inactivity. Furthermore, Furthermore, people with higher economic status have a higher number of risk factors. Implication: reducing NCD risk behavior by primary prevention is urgently needed. So, policy should monitor lifestyle behavior and prevent NCD risk factor in those with high economic status. Thank you for your attention.
Thank you very much for your presentation. I think it's really interesting topic. I just have one point that I would like you to clarify for us. When you identify clustering, that you just mentioned that you will collect only the number of it, right? Is there any difference between the number and the type of risk factor? Do you have any like a cluster that you can specify the type of risk factor? For example, you just mentioned here, like smoking together with overweight may be different from those physical inactivity and unhealthy diet something. Do you have any finding on that part? Thank you. And not just only number, but the type of the risk factor. Yeah.
This past
my question.
yes. Um, When diagram identify with risk factor common occur together, they determine the priority of risk factor and decided which one should be first, and intervention in strategy.
I have a question about age distribution because 92% of your sample had NCD, at least one risk factor. What is the age distribution? You have 26 million people in your data set, right? What is the age distribution of the 26 million people? I think you have one table that you went by very quickly on the age, this one, yeah.
Yes. I adjust for other variable, 6, 8, resident education, living arrangement, economic level regions. The survey is above 15 years. Yes, and I analyze data from 2021 survey. Yes.
Steven, can I have some question?
All again, please.
Okay. Do you look have you looked at other factor, for example, location or geographical distribution of the population in your study? For example, stratified by geography area.
Areas is 60 77 province ก็คือ in province Thailand all province and separate which regions Bangkok Central Northern Northeast Eastern Southern.
No, what I mean is to investigate the similar, I mean the same pattern within the central region is different from northern region or not.
ก็คือก็คือ
Okay, maybe it's a case you further study into certified by other factor also.
Yes, study identify another factor and results that regions in Bangkok Central Northern Eastern and Southern is ดูแบบ not yes แบบ I'm not no interesting but in economic status is interesting. I by limit time I will show you about economic level because impact more. Yes.
Okay, thank you.
Thank you.